Hey everyone, I'm going to show you how to use the Acubase. You want to have one Acubase for every size of needle that you have. One Acubase, one Acuclip for every size. And you will get 2 magnetic strips for every Acubase. So I'm going to show you here how I'm going to arrange my clinic countertop with the Acubases so that I'm going to work with my needles here. When I switch sizes, I have them all sitting there. And then I'm going to take some of these magnetic strips and I'll show you how I'm going to put them on a place close to my treatment table so I can kind of park my needles sometimes over by my treatment table and sometimes over here, and I have a workflow that allows me to safely contain my needles, keep them off surfaces, and manage my tubes so that they're all in the right place. And when I'm finished with that one patient, I'm pointing here because that's where the treatment table is, and when that patient's gone, I'm going to take that tube and recycle it in the little bin here. I'm going to take my little pouch and recycle it in that little pouch bag over there, so that at the end of the month I can throw all of that into the recycling area and have it repurposed. So let's get started. Okay, so I got my Acubase, I got my Acustrips. Okay, so I'm taking a strip and I'm going to arrange. I've got my 30mm needles, my 40, 50, and 60mm needles here. So I'm going to arrange my my parking spot number 1 for my Acustrips over here in a nice way that they're all contained, and so I know where everything is. So I'm going to peel off adhesive on the back. Here, so just I know. The problem being a practitioner is that you don't have nails anymore, right? So anyway, I'm going to peel them off here. Okay, so I'm peeling them off, and be very careful because once this hits the surface, it sticks really well. So you peel off, keep your fingers off the glue spot. I'm going to line my metal strip in the space that I want. So I'm going to put it on my countertop. Once it's there, it's there. So you want to make sure that this is your working surface. It's your clean surface for clean needle technique. This is your clean surface. I've swiped it, I've cleaned it, it's ready to go now. And I've placed my Acustrip, my metal strip down, and I'm going to just press on it for 10 to 20 seconds to make sure that it's nicely adhered to the surface. And the new ones come with a little blue covering. And so when you get that, to get it to look like the shiny surface like this, you want to take off a little blue protector sheet that keeps it nice and clean during shipping. And again, my nails are small, so but anyway, it'll peel off and it'll look like that. So I've done number 1. I'm going to do number 2 and 3, and placing it in a way that makes sense for my workflow. You want to think about consciously, like, just how do you arrange your sizes of needles and how you're going to keep your clean space in an effective way for you to easily work with your needles. Okay. Try to line them up so that they're all looking nice. And if you make a little mistake, if you pull them off right away, it works, but if you leave them on too long, they're going to be a little bit harder to remove. Okay, so that's just lining it up again. So I've got my 1, 2, 3, and I got one more for my. So if you had more sizes, you would just partition your workspace with the Acustrip, the strips and the bases, so that everything makes sense for you, and it becomes a kind of like, you don't even need to look anymore at the sizes because you know what each position is holding. Okay, so now I have my 4 strips for each of the 4 sizes, and I have my bases here that I can park my Acuclips. and they're ready to go. So I have some old needles here that I've just going to take out. That goes there. Between patients, when you finish your pack of needles, you just open the clip and put your pouch in the recycling bin, and you've got your clips now ready for each size. And there you go, you're all set up. Now I'm going to put it in my next parking spot, which is by my treatment table. Alright, so now I have my parking spot number 1 where I have my Acubases and clips on my treatment table. That's my clean needle space. And then I've got my treatment table here where the patient will lie down. So I want a second parking spot, so when I've got a couple of sizes of needles on the go, that I can easily access the different sizes and have them kind of contained in a nice, easy way for me to reach. So I've got my strips, and I'm going to choose this spot over here on the wall, which is right by my treatment table. You choose to park your needles on as a second place on a tray, for example, and I'll show you how to do that in a minute. But for now, I'm going to take these strips and I'm going to put them on the wall here with enough distance between each one so that I can keep the different sizes of needles separate from each other, and they won't be banging into each other. So here I go, gang. My short nails, removing the tape. Okay, so I'm going to try to get it level because I'm the kind of person that if it's not level, it's not going to look right to me. So make sure you get it right. And because it's, well, yeah, see, there you. So I've got it on the wall here. And I'm going to press for about 30 seconds just to give it a good adhesive. And it's got the blue cover on here. Once I've pressed on it, just rub it a bit, and then that edge will come off eventually if I get my nail on it. There we go. And there you can see that'll come off, right? So now you've got your one strip, and I'm going to repeat with my other 4 strips for my different sizes. So I know my needles are kind of like that, so I'm just going to put my next one, line it up, so it's all nice and even. And I probably will just use 2 of these strips here because I probably won't be doing more than 2 sizes at the same time. Of course I can add more strips if I want. Again, it's up to you how you design or how your room is shaped up, but it's convenient for me. Maybe you don't have a wall that's close by and you have a trolley where you put all your stuff on, and in that case you may want to use a tray where you put your second parking station for your needles. So now I've got that there. So now you can see I can put my Acuclip, my Acubase there on the wall there as I'm treating the patient. I can flip between, I've got my tube in a nice convenient space. I can insert my needle with that tube. I can put it back on the Acubase, put it there and switch to my different size, and we'll see how we do that in a bit. But now you've got your parking spot number 2 here, and your other parking spot is the other place, which is on the counter. Parking spot number 1, you've got your needles all nicely contained. Tubes are all managed. Your clean needle technique is perfect. Okay, so I actually decided to put a couple more of the metal strips in a separate location because if I'm working by the feet, it'd be nice to just plunk them there. If I'm working by the head, I can plunk them here. So you can make an arrangement any way you want that makes sense for your clinic room. And as I said, if you don't have a wall close by, you may put the metal strips on a tray. This tray is not magnetic generally, but when you put the metal strip on, then voila, you got your needles on the metal tray, very easily held in place. And then you can walk around between clinic room with your group of active needles that you're using without them falling out. See, I've got like a pack of needles sitting there all kind of contained. And you'll see when I have this whole tray filled out. Okay, so many options. Parking spot number 1, parking spot number 2, or parking spot number 3. You've got your needles handled any which way you want. So I've got my metal strips now positioned in front of the size of needles that I use, 30, 40, 50, and 60 millimeters, or 1 cun, 2 cun, 1.5 cun, 2 cun, and 2.5 cun needles. And I have my Acubase with the Acuclip. I've got a tube ready here to go. And I want to show you, just take your needles out, your pouch, clip on the clip, tear off the pouch, and now there's your needles that you're going to use for the patient. You may have some left over, but that's fine because they're sitting in the pouch and they're contained. You can just keep them there ready for your next patient, and on you'll go. Okay, so I've set up all my needles now. The pouches are all open. I've got my Acubases ready to go. I can take my Acubase with me to the treatment table and it's all nicely ready. And I got my tubes all aligned. I'm ready to start treating.